Victoria has seen a jump in local COVID cases as the virus again spreads to regional areas. 450 new cases have been detected, with 134 people now in hospital. Dana Morse has more from Melbourne.
There are, unfortunately, as you say, 134 people in hospital here in Victoria. 450 new cases were reported today, and that takes us to 2,069 active cases that have been locally acquired across the state. 85% of the people acquiring the infections are under the age of 50, and that is the age group that has only more recently become eligible to get vaccinated. Of those people that are in hospital, 34 are in the intensive care unit and 26 are on ventilators. What was interesting to come out of today's case numbers is there are 3 people who have been linked to hotel quarantine. Now, there's 1 person who works at Melbourne Airport and 2 who work at quarantine hotels here in the city. Interestingly, health authorities believe that those 3 people acquired their infections in the community, and there's no evidence of a hotel quarantine link as yet. There have also been 8 cases reported outside the regions of Greater Melbourne and Greater Shepparton. Now, Greater Melbourne and Greater Shepparton remain locked down, but the regional lockdown was lifted only a couple of days ago. So far, we have 1 case in Kahuna, 1 in Daylesford and 1 in Beveridge, and there have been 5 cases reported in the Greater Geelong region. 3 of those have been linked to construction, and that forms part of the picture as to why construction is emerging as an area of concern for health authorities. Now, today, the Health Minister was very quick to say that construction is an essential service and should be able to proceed, but there is going to be a crackdown on the policing of construction and how they abide by those rules. To put that in some context for you, we currently have 116 positive cases linked to a construction site in Box Hill, and authorities are saying that that number will grow because there are day 13 tests coming up in a couple of days, and they're expecting more positives from that site. We also have 9 positive cases connected to an EY construction site here in Melbourne, and again, authorities are expecting that number to grow. So looking at this construction crackdown that was announced today, what's going to be more strictly watched is going to be that 25% capacity limit. So currently construction sites are able to operate, but they can only have 25% of the usual number of staff working on site. The other thing that will be very closely looked at is compliance with COVID safety plans. They've had to submit COVID safety plans in order to operate, and they're going to be watching very closely to make sure that those are being followed.
So if I had one message today, it was that all workers, big and small, in the construction industry need to make sure that they follow the rules, and that the time for continuing to hand out warnings in the sector is over, and that a combination of the authorised officers, WorkSafe inspectors, and indeed the leadership of the sector itself is about making sure that the spike that we've seen in construction-related cases comes to an end.
Victorian Health Minister Martin Foley ending that report from Dana Morse. Well, from tomorrow, pregnant women will be given priority access to a vaccine. There's growing concern about the impact of Delta. 7 pregnant women are in hospital, including 1 in intensive care. Expectant mothers who end up in hospital have a 50% chance they will need an emergency delivery. Ryan Hodges from Monash Health says pregnant women are at a higher risk of respiratory illness.
It's no longer what do I avoid in pregnancy to keep my baby safe. It is now what do I do in pregnancy to keep my baby safe, and that is vaccination. We are concerned. It is very early on in this next wave, and what we are seeing is not what we saw in the last wave. This is not what we see with influenza. Never would I have 7 sick women in hospital with influenza. This is different.
Case numbers in New South Wales remain high. The state has recorded 1,599 local cases and 8 deaths. None of the people who died had been vaccinated. Statewide, more than 77% of people over the age of 16 have received their first dose. Authorities want that number even higher to prevent more deaths.
The most common theme with these patients, as you've all heard many times at these press conferences and today, is a non-vaccinated status, and it's awful to see these patients in this condition. Often the people we are retrieving are young, they're previously healthy, and one that stands out to me was a young woman I recently transferred who had just delivered a baby. I view our role as not only a responsibility, but it's also a privilege to manage these critically unwell patients. I also have a very strong view that each member of the public also has a strong responsibility, and that is to get vaccinated and to do it now.
More than 1,100 people in hospital and more than 220 are in intensive care. Close to 100 people are on ventilators. Despite the pressure on hospitals, the Health Minister is calling on people to come forward for care after 2 people died at home, unaware they'd contracted the virus.
This is a disease that's highlighting some of it's a virus that's highlighting some of the inequities in our community. And in some households, it can be a very large household where only 1 or 2 people are working. And I think there is a reluctance in many instances for people to want to actually tell us that they're actually not well because they want to go on earning income. I just say to those people that the federal government and the state government have put up economic packages. There's also lots of other support for you. And the most important thing is to stay alive. So please don't hesitate to contact our health system for support.
Despite the record case numbers and ongoing lockdown, today's warm weather has led thousands of people in Sydney's east to hit the beach. Cecilia Connell reports from Bondi Beach.
It is a beautiful sunny day here at Bondi Beach in Sydney, this iconic stretch of sand. As you may be able to see behind me, quite a few thousand people have gathered here today to take advantage of this sunny weather. There have been police out and about patrolling to make sure that people are socially distanced, but there are, as I said, quite a number of people here today. People I've spoken to have said they're taking advantage of this weather to really get out and boost their mental health and do some exercise. There's been people picnicking here with their families. On the beach itself, not a lot of masks being worn, but if we head to the shopping strip here in Bondi, people are lining up wearing masks. But as I said, there are police out and about and council rangers. They were aware of this weather, of course, being on the cards, so put plans to that effect in place. But as I said, lots of people here enjoying this sunny weather as they get a taste of hopefully what will be to come as that vaccination rate increases.
Yeah, I think just from a mental health standpoint for most people here, like this is a great way to recharge, you know, because your living room's your office, right, at the moment. So just being able to kind of get out, get a bit of fresh air.
I honestly think it's just going to lift everyone's spirits.
It's really exciting. I think we've all been doing it really tough for so long, so I think it's well deserved for us.
The people here are really keen to, you know, just making sure that people are staying healthy. This is our vibe, you know, we stay healthy here and we follow the rules.
Meanwhile, parts of regional New South Wales have come out of lockdown. Reporter Melinda Hayter has more from Wagga Wagga.
As of midnight last night, the stay-at-home orders in this part of regional New South Wales were lifted, meaning people are now able to get out and about in the community. There's been, I think, a mixed reaction to that news. Certainly here in Wagga Wagga, there hasn't been a case of COVID living locally for over 12 months, and across the wider Riverina, there are some communities that haven't seen a case of COVID throughout the entire pandemic. We have seen a number of exposure sites across the region in the last few weeks. They haven't resulted in any cases of community transmission, but given the situation in Sydney, certainly what's happening up in Dubbo to the north and the situation in Victoria to the south as well, I think there is some concern from some members of the community that opening up lends the region to a sense of vulnerability that hasn't been there before. On the flip side, though, it is a beautiful spring day here in Wagga Wagga, and certainly we are seeing lots of people getting out and about and enjoying this newfound freedom. The cafe behind me, there's been people coming and going all morning, sitting down, friends getting together for the first time in many weeks. We spoke to Jesse Rendell, who manages the cafe, and he told us just how tough the last couple of weeks has been.
It can wear people down a bit because I think a lot of the pride and joy of the cafe actually comes from serving the customers day in, day out, you know, getting to look after them, see how they're going, and just that relationship that you're doing. But when you have to put a mask on and, you know, it's just a takeaway transaction, you're not really building much relationship there. It's actually so exciting. Yeah, we can't wait to just be serving people. So, yeah, I think a lot of our cafe is revolved around that relationship between the tables, just because it's a community of place, so we just get to hang out with people, really.
All of this comes on the proviso that if there is a case of COVID that is recorded in a regional location where lockdown has lifted, that region will automatically go into a new 2-week lockdown.
The ACT has recorded 15 new locally acquired cases of COVID-19. All but one are linked to known infections. 9 of the cases had been in quarantine for the entire time they were infectious. There are now 16 COVID patients in hospital in Canberra. 3 are in intensive care, 1 is on ventilation. There is a continued push for residents to get vaccinated, and people with appointments may be able to move them forward.
Around 19,500 first dose appointments at ACT government clinics were able to be brought forward as a result of the release of those additional appointments. That's fantastic news. Lots and lots of people were able to bring forward their first dose.
Queensland has avoided a lockdown despite 5 new local cases emerging overnight, all from the same family. New exposure sites have been listed after a school student on Brisbane's south side spent time in the community while infectious. The Premier, Anastasia Palaszczuk, says no lockdown is planned yet, but the situation will be closely monitored over the next 2 days.
There is no lockdown today. But I will say this, over the next 48 hours, we'll be closely monitoring the situation. And if we start seeing any seeding, then we may have to take very quick, fast action. But at the moment, it's contained to the family. We also have that young girls' school community. They've gone into home quarantine, about 1,000 people there. So we know that people are doing the right thing.
Authorities in South Australia are racing to trace contacts of a mine worker who was tested positive after arriving from Sydney. The man went straight into quarantine at the Adelaide Airport Hotel under the mining company's policy. South Australian Health will be contacting other passengers on his flight.
My team is in at work this morning. They're looking at that person's movements. They're pulling the QR codes because there will be people in South Australia who receive an SMS about this exposure. My understanding, and many people who have travelled recently, is that you do need to wear a mask on the planes, but we will be looking at that flight manifest as well